Hello, my name is Teresa Stack. I'm an associate professor at Montana Tech, and this learning unit is the second in our series of Measure of Disease Frequencies, and this one will cover prevalence. Prevalence, or to be more correct, prevalence proportion, is sometimes also called point prevalence. This gives us a figure for a factor at a single point in time. We may want to know how many children are overweight in a country. By measuring the height and weight of every child of a particular age in a sample of children, we can calculate their body mass index and have some idea at that point in time how many children are overweight. This is prevalence. The important words are at that point in time, because prevalence can tell us only what is happening at a certain point in time. That is different than incidence. Incidence tells us how many new cases are occurring at a point in time or over a period. So we have our 5 types of measurements: counts, ratios, proportions, rates, and risks. And again, we're going to use our proportions to do our calculation, but this time the number in the numerator will be slightly different, because instead of looking at incidence, the occurrence of new diseases, we're going to be looking at prevalence, and that's existing disease states. Prevalence is the frequency of a disease state at a point in time. It applies to disease states, not to diseases that are defined only as events. So we wouldn't use prevalence for most injuries. We wouldn't use prevalence for 24 hours events, such as Norwalk virus. We wouldn't use it for sudden deaths or for asthma attacks. We use a simple proportion, again, the numerator over the total population at risk, or an average population at that point in time. So it has no units other than percentages. The people in the numerator are also in the denominator, and because the denominator is the population at risk, we can make a valid comparison of different populations of different sizes, because it's simply the proportion within that population, and then we can make a valid comparison this way. Prevalence and incidence are different measures of a disease occurrence. The prevalence of a condition means the number of people who currently have the condition, whereas the incidence refers to the annual number of people who have a case definition of the condition. These two measures are different. A chronic, incurable disease like diabetes may have a low incidence but a high prevalence, because the prevalence is the cumulative sum of a past year's incidence rates. A short duration curable condition, such as the common cold, can have a high incidence but a low prevalence, because many people get a cold each year, but very few people actually have a cold at the same time. So prevalence is low and is not a very useful statistic. Some factors that influence prevalence. Prevalence is increased by longer duration diseases, or prolonging somebody's life with a certain disease. So, for example, HIV is prevalent in the population now, although the incident rate has been pretty stable over the last 10 years. If we had looked at the prevalence of HIV in the early 1990s, it would have been low because people weren't living very long with HIV. So also improved diagnostic, either screening tools or facilities, will help to increase the prevalence. We'll know about them sooner. Prevalence is decreased by shorter duration diseases or diseases like Ebola, which had a high case fatality rate. Prevalence can also be decreased by improved cure rates. There are 2 main types of prevalence: point prevalence and period prevalence. Point prevalence is defined as the number of existing cases in the total population on a very exact date, a point in time. The CDC uses June 1st for the midpoint in the year. Period prevalence is the number of existing cases over the average population for a time period. So this is our interval. So you can see the two differences, a point in time and the total population versus the average population and a time period. So some other separations of prevalence could be thought of in the way the question's being asked. What are we looking for? Do you have asthma now? That can be an example of point prevalence. Have you had asthma in the last year? An example of period prevalence. Is this the first year that you've had asthma? Would be an incident rate. So let's take a look at point prevalence. Assuming you had medical records to describe the disease of an entire population, this could be your workforce, what is the point prevalence on May 15th? So here are your records, and the circle designates the onset of the disease in which you're studying. D denotes death, and C denotes that the person was cured. So what would be our point prevalence on May 15th? We have 1, 2, 3, 4, 5 cases over the population in May is 500, and this would give us a point prevalence of 10 cases per 1,000 people. So with prevalence, just like with incidence, we always put it in a rate in which we can understand. And I thought I'd throw a prevalence chart up there. County level diabetes in the United States in the year 2007. So another statistical chart before we move on to prevalence, period prevalence, would be the top 10 leading causes of death in the United States. And death is, of course, an incidence rate, but we have heart disease, cancer, chronic lower respiratory disease, accident, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, kidney disease, and suicide. And this is per 100,000 people. So now let's take a look at period prevalence. Again, assume we have the records for an entire period of time, and we want to know what the prevalence is between January and September. Here's our data. How many cases did we have between January and September? 1, 2, 3, 4, 5, 6, 7, 8. We had 8 cases. And therefore our period prevalence would be 8 over 500. We use the average population. Times 1,000 gave us 16 cases per 1,000 people between January and September. This is an example of period prevalence. So I'll give you an opportunity to do this example on your own. What is the period prevalence between February 1st and February 28th? What's the point prevalence on February 28th? And what is the incidence rate within February? Prevalence attempts to measure the number of people affected by a condition at any given point in time. There are various possible problems with using prevalence data. Diagnosis versus undiagnosed prevalence. Two estimates of prevalence are not necessarily comparable. Some estimates attempt to quantify the number of diagnosed people. Other prevalence attempts to estimate and include undiagnosed people who unknowingly have a condition. Some prevalence numbers include only symptomatic conditions, whereas other may include latent infections. Different methods of gathering prevalence data. Prevalence numbers may also have been computed via various estimates methods ranging from research studies to just phone surveys. Prevalence and cured or remission conditions. Conditions that go into remission but are not necessarily cured, such as cancer, cause problems for prevalence data. Some such estimates use 5-year prevalence or 10-year prevalence estimates, which includes only people who have had cancer 5 or 10 years previously, even if they are cured. This effectively assumes that a remission becomes a cure after 5 to 10 years, so the person is then excluded from the prevalence numbers.
Hi, and welcome to this quick overview of public health surveillance. We'll take a look at what it is, different types of surveillance, and look at what makes a good surveillance system. Surveillance is defined as the ongoing, systematic collection, analysis, interpretation, and dissemination of data regarding a health-related event for use in public health action to reduce morbidity and mortality and to improve health. Historically, surveillance was mainly used to monitor infectious diseases. However, it can be used to monitor any health-related event, such as chronic diseases, injury, health services uptake, vector distribution, or environmental hazards. Surveillance can be thought of as the eyes and ears of public health. The information gained from surveillance can be used for characterizing the patterns of disease, detecting outbreaks, suggesting hypotheses for further investigation, identifying cases for further research, guiding disease control programs, setting public health priorities, or evaluating health programs. Surveillance systems have a few basic elements. First is the way of detecting health events and notifying them. This is usually done by a health service or laboratory. Then the information needs to be collected and stored in a systematic way. This data then needs to be analyzed and interpreted. And finally, this information has to reach the right people so that appropriate action can be taken. So now, let's have a look at a few different types of surveillance. Passive surveillance describes the routine reporting of health data. Let's have a look at some examples. In most countries, there are a number of diseases or conditions that are required to be notified by law. Surveillance of these notifiable diseases rely mostly on a passive system. Another example is a registry, which is a collection of health data. Registries can have data on births, deaths, cancer, chronic diseases, and a variety of other diseases. Healthcare providers like hospitals also routinely collect data on the number and type of patients that seek treatment. This is another example of passive surveillance. Passive surveillance is a valuable source of health information. One of the biggest advantages of this type of surveillance is that it's generally inexpensive. It can be used to provide baseline data on the health of a population, monitor trends, or monitor the impact of an intervention. Also, different types of these data sets can be linked to provide a complete picture of health. There are, however, a number of limitations of passive surveillance. The main one is underreporting. Diseases can be underreported because people have mild or asymptomatic illness and don't seek medical treatment for their illness, or there's a lack of access to treatment. It could also be because laboratory facilities needed to diagnose a disease are not adequate, or that there are logistical problems with reporting disease. In fact, there can be a lot of variation in passive surveillance systems from country to country, which is a reflection of social, economic, cultural, and epidemiological factors. Now, let's take a look at active surveillance. In contrast to passive surveillance, in active surveillance, health data is actively sought out. This type of surveillance is commonly used during outbreaks. For example, during an outbreak, health teams may visit the community to actively seek out cases that may not have otherwise presented to health centers. Another example of active surveillance is serosurveillance. This involves testing blood in a selected population for various markers. For example, checking for antibodies can be used to check for active or past disease. Health surveys are also a good example of actively seeking out health information. Surveys can be done on community members, healthcare facilities, or entire countries. They can be done on an as-needed basis or regularly. Active surveillance provides more complete and better quality data, but is more resource-intensive. Another type of surveillance is sentinel surveillance. This type of surveillance uses selected institutions or groups to provide health data on specific diseases or conditions. It can be useful for monitoring diseases, trends, and detecting outbreaks. A disadvantage of sentinel surveillance is that because it's restricted to a few institutions or groups, it cannot detect events that happen outside these. Therefore, it's not that useful for rare or uncommon diseases. Another form of surveillance that's becoming increasingly useful in today's interconnected world is rumor surveillance. This type of surveillance relies on unofficial sources of information like blogs, internet discussion groups, media, hearsay, and social media sites. Rumor surveillance can alert public health authorities to incidents or events that require further investigation and can lead to early detection of disease outbreaks. The next type of surveillance is syndromic surveillance. This involves monitoring non-specific syndromes like presentations for fever, respiratory or gastrointestinal illness, or other indicators that might highlight illness like the purchases of medicine or absenteeism from work or school. The aim of this is to allow early identification of clusters of illness before diagnoses are confirmed and reported to public health agencies. Syndromic surveillance usually relies on automated electronic methods. There are other types of surveillance systems as well. For example, ProMed is a website that puts together reports of disease events, and the Global Public Health Intelligence Network is an internet-based early warning tool that uses an automated process to monitor online news sources for diseases or significant health events. While there are many different surveillance types, each with its own advantages and disadvantages, an integrative approach using all sources of information provides the best overall picture of health. Okay, now we've had a look at different types of surveillance systems. Let's have a quick look at what makes a good surveillance system. Firstly, a good surveillance system must have clearly stated objectives and have a good system to ensure that these objectives are achieved. Other characteristics include simplicity. It should be easy to operate and have straightforward case definitions that are easy to apply. It should be flexible to accommodate changes in information needs or conditions in which it operates with minimal additional resources. The data should be complete and accurate and be of good quality. It should be accepted by people and organizations participating in surveillance. It needs to have a good sensitivity and positive predictive value. It should pick up most, if not all, cases of the disease that exists in the population. Surveillance data should be valid, meaning that it measures what it intends to measure. The system must accurately represent the occurrence of a health event in the population that is being studied with regards to time, place, and person. It must detect health events in a timely manner so that authorities can take appropriate action. The resources involved in running the system, both human and material, must be stable and available when needed. It's also important that surveillance systems are evaluated routinely to make sure that they continue to meet their objectives and that they're serving a useful public health function. And finally, surveillance isn't just about monitoring health events, but providing useful information to enable public health action. So that's an overview of public health surveillance. We've had a look at what surveillance is, different types of surveillance, and characteristics of a good surveillance system.
If you have not had the opportunity to explore the NIOSH Work Health Surveillance website, I urge you to take a look and do that and see the different initiatives that NIOSH has put forward, especially on with using their mobile van and looking for respiratory illness or the start of respiratory disease in coal miners. So let's end this learning unit with seeing if you can answer some questions. And I hope you have a pleasant day.